How do you distinguish different types of necrosis? Imagine walking through a tissue sample and trying to figure out what kind of cell death has taken place. That's what pathologists do when they look at necrosis. Necrosis is the uncontrolled death of cells or tissues, often caused by injury, infection, or blood supply problems. During medical school, especially in pathology courses, learning how to tell different types of necrosis apart is super important because each type hints at different causes and clinical situations. The main way to tell them apart is by examining how the tissue looks both with the naked and under the microscope. There are 6 main patterns of necrosis. First is coagulative necrosis. This usually happens when tissues like the heart, kidneys, or adrenal glands lose their blood supply. The tissue becomes firm and pale. Under the microscope, the cell outlines stay visible even though the cells are dead. This happens because the proteins in the cells coagulate, keeping the tissue structure intact for a while. Next is liquefactive necrosis, which is common in the brain or in bacterial infections. Here, dead tissue turns into a liquid, soft mass. Enzymes from immune cells break down the tissue, so the area looks cystic and often contains pus. Microscopically, you see a mix of dead cells and inflammatory cells with no preserved tissue architecture. Then we have caseous necrosis, which is a special form of coagulative necrosis. It's mostly linked to tuberculosis. The tissue looks soft and white with a cheesy texture. Under the microscope, the tissue appears fragmented and is surrounded by immune cells, forming a granuloma. The tissue architecture is completely destroyed. Gangrenous necrosis is not a separate type but a term used when large areas of tissue die, often in limbs. Dry gangrene looks like coagulative necrosis with dry, black, mummified tissue. Wet gangrene involves infection and looks like liquefactive necrosis, with moist, foul-smelling tissue. Fat necrosis happens when fat cells die, often due to trauma or pancreatitis. The dead fat cells releases fatty acids that combine with calcium, forming white, chalky deposits. This is common in the breast or pancreas. The area may feel firm and can sometimes be mistaken for a tumor. Lastly, fibrinoid necrosis occurs in blood vessel walls, especially in conditions like high blood pressure or autoimmune diseases. Immune complexes and fibrin build up, making the vessel wall look pink and amorphous under the microscope. The tissue appears damaged and inflamed. Medical school, recognizing these differences helps you understand what caused the tissue injury. For example, seeing caseous necrosis in a lung biopsy points to tuberculosis. Finding fat necrosis in the pancreas suggests pancreatitis. Knowing how to distinguish these types is key for accurate diagnosis and treatment. The main way to tell them apart is by looking at the tissue's gross appearance and microscopic features, considering the organ involved and the clinical context. This skill is essential for pathology exams and for real-world clinical practice.